Hi everyone, welcome to my channel. My name is Midwife Sally, and yes, I have been receiving this particular question almost every day. So I decided to come and answer this question. Okay, so a lot of moms keep asking, how do I resume sex after I have given birth? Okay, so it's a main concern for a lot of women. Okay, so when is the appropriate time to even start? Okay, so let's talk about that. Okay, so the appropriate time to resume sex after birth is usually after you have healed completely. People heal differently. And so, let's say the first 6 weeks, a lot of women would have healed. So, I would say that after the first 6 weeks is the ideal for the average woman, okay, because at that time a lot of women would have healed of their episiotomy, their wounds, they feel healthier, and they have recovered from all those postpartum pressure and all that. Yeah, so after 6 weeks, the woman, most women will be fully ready, but not everybody. Okay, and some women, especially those who went through vaginal birth, they would have even been ready. Let's say even just after 4 weeks. Okay, a lot of women too want their lochia to have ceased, which is ideal. The lochia is the bleeding that you see after birth. Okay, and then this lochia, it is ideal to let it stop completely. So after the lochia, or you are not seeing the blood again, the episiotomy has healed. If you had a cesarean session, the wound has healed, and you don't feel pain you don't feel pressure, you are in control of your mental health, then you could be ready. Your emotions are also very important. Okay, yeah, so all that being said, if all these things are in place, then you could be ready to meet with your partner in an intimate way again. Another thing I would also talk about is the concerns of, will I be getting pregnant around that time? I would say that yes, we all know about lactational amenorrhea. We talked about breastfeeding, and then the woman is not going to get pregnant. Okay, but then it doesn't work for everybody. So I advise that if you have concerns about getting pregnant soon after birth, the best is to get a family planning um, at your 6 weeks booking. Okay, so when you go for your 6 weeks booking to check on your baby, they can also have a family planning method for you. Even at birth, they can insert some of the family planning methods. Okay, if you are comfortable with it, they can do it for you right at the delivery room or the cesarean session room. Okay, yeah, so think about how to protect yourself so that you do not get pregnant. Another concern for a lot of women too is dryness. Okay, because of vaginal dryness, because of the hormones. Okay, so because of the hormones that are changing, breastfeeding and all those things, a lot of women will experience vaginal dryness after they have given birth. Okay, and so in resuming, and for those who had episiotomy, sometimes it is painful when they are resuming sex again. So you can decide to get a lubricant which is water based, and then use until you feel a bit more comfortable. Okay, so these are the things that you should consider. There's no definite time that it has to be 6 months, or no, 6 months. It's even too long. Okay, just after 6 weeks, even 4 weeks for some people, especially vaginal birth, they are ready. Your husband and yourself would have to be emotionally ready for it, all of you, and you have to take it a bit slow and understanding each other so that the woman does not feel too much pain. In case you start and you feel pain, you feel bleeding, you feel any serious discomfort, you need to stop and you need to check it up with your doctor or with your midwife. Okay, yeah, so that is basically it. If you are able to check all these things, there's no reason why you cannot be intimate with your partner. So, as I said, it is just about understanding, self care, making sure that you are ready physically, emotionally, and all that. Okay, yeah, so I believe that I have answered your question. Thank you so much. My name is Midwife Sally. Please follow the channel and invite other people to also follow the channel. Have a great day. Bye.